Hello, welcome to the Avexia Diagnostics video series on ready-to-run Avexia panels. This is Part 5, and will cover an overview of specialty panels, Part 2. Now, the presenter for today's topic, the Director of Clinical Support and Education, Dr. Wayne Sedano.
Hi, this is Dr. Sedano, the Director of Clinical Support and Education at Avexia Diagnostics. Welcome to the Avexia Diagnostics Specialty Panels Overview Part 2. This presentation reviews the analytes included in each panel outlined in this presentation and their clinical usefulness. So let's get started. So this presentation reviews the 4 specialty panels you see on this slide. There's a comprehensive bone health panel, the complete and comprehensive prenatal panels, and the comprehensive sexual health panel. So here's a little background regarding bone health. Now, according to the U.S. Prevention Services Task Force, approximately 12.3 million individuals in the United States older than 50 years of age were expected to have osteoporosis by the end of 2020. They also reported that osteoporotic fractures, particularly hip fractures, are associated with limitation of ambulation, chronic pain and disability, loss of independence, and a decrease in quality of life. They also reported that about 21 to 30% of individuals who experience a hip fracture die within the first year. So it's important to remember that bone is living tissue and normally breaks down and builds up at a constant rate, much like the skin cells. And an imbalance in bone metabolism can cause osteopenia, which is decreased bone density, and eventually osteoporosis, which, as you know, is bone loss. Now, the Avexia Diagnostics complete and comprehensive prenatal panels, now they're going to contain tests to check the health of a woman before pregnancy. And these tests can check for certain conditions and infections that would harm the unborn baby or affects the mother's health during pregnancy. They also help provide any treatment needed for the mother during pregnancy and for the baby immediately after birth. Now, in regard to the comprehensive sexual health panel, now this panel is a group of tests that should be considered if there are concerns about having or spreading a sexually transmitted disease and unprotected sex with multiple partners. This panel also provides a comprehensive assessment of overall health. Now, another great feature of the specialty panels and all Avexia diagnostic panels is that they come with a functional health report. Now, this type of report looks for early changes in blood chemistry that can indicate the risk or potential presence of many health conditions. Some of the benefits and features of the report include a look at the optimal and standard reference ranges, a historical comparison of the previous blood test results, and details about each analyte and nutraceutical recommendations. Now, each panel in this presentation contains core analytes and tests that you see listed on this slide. So there's the CBC with differential comprehensive metabolic panel, estradiol, ferritin iron and total iron binding capacity, GGT, hemoglobin A1c with the average glucose, homocysteine, insulin, lactic acid dehydrogenase, the lipid panel, serum magnesium, uric acid, and a urinalysis that's complete with microscopic examination. So let's take a look at these analytes and tests individually. The CBC with differential provides a substantial amount of information that's going to assist in the diagnosis and treatment of many conditions such as anemia, infections, cancer of the blood cells, inflammation, environmental toxin exposure, renal disease, liver disease, autoimmune disease, and nutritional deficiencies. Now, the components of the CBC are listed on this slide. Next is a comprehensive metabolic panel. Now, as you probably know, the CMP is a group of tests that measures several individual substances in the blood that provide information about electrolyte balance, liver and kidney function, glucose regulation, and the level of proteins. So now I want to take a look at the remaining core analytes as it relates to the bone panel, the prenatal panels, and the sexual health panel. First, as you see, is estradiol. Now, it's important to know that estradiol, estrone, and estriol are collectively known as estrogen or the estrogens. And the primary function of the estrogens is to cause cellular proliferation and growth of tissues of the sex organs and other tissues related to reproduction. Now, the estrogenic potency of estradiol is 12 times that of estrone and 80 times that of estriol, making estradiol the major estrogen. Next is assessment of iron metabolism. Now, aside from assessing the nutritional status of this mineral, the iron panel assesses for such conditions as iron deficiency anemia, excess iron supplementation, and iron metabolism conditions such as hemochromatosis. And as you can read on this slide, the panel includes serum iron, total iron binding capacity, which is TIPC, and ferritin. Next is the enzyme gamma-glutamyl transferase, or GGT. Now, GGT is found in many organs throughout the body, but it has its highest concentrations in the liver. GGT is elevated in most diseases that cause damage to the liver and or the bile ducts. What this enzyme does is that it participates in the transfer of amino acids and peptides across the cell membranes, and it's also responsible for extracellular metabolism of glutathione, which, as you probably know, is the main antioxidant. Next is the hemoglobin A1c. Now, fasting glucose, which is in the CMP, along with the hemoglobin A1c, that's going to provide information about glucose metabolism. And when it's abnormal, it can be an indicator of prediabetes, insulin resistance, or diabetes. Now, the A1c test evaluates the average amount of glucose in the blood over the past 2 or 3 months by measuring the percentage of what's known as glycated hemoglobin in the blood. Now, the estimated average glucose, what that does, it converts the patient's hemoglobin A1c percentage point into the average blood glucose level. Now, similar to the hemoglobin A1c, the estimated average glucose evaluates the patient's overall success in controlling glucose levels and helps the patient understand the monitoring for the long-term treatment. What I also want you to remember, and I cannot overstress, is that blood glucose dysregulation is related to metabolic syndrome, obesity, inflammation, and oxidative stress. Next is homocysteine. And normally the body converts homocysteine into other products quickly, and certain nutrients are required for that conversion, such as vitamins B6, B12, and folate. Now, an elevation in homocysteine is a risk factor for coronary artery disease, stroke, peripheral vascular disease, and atherosclerosis. Next is fasting insulin, and measuring fasting serum insulin when compared to fasting glucose, that can provide information pertaining to the possibility of insulin resistance, diabetes, prediabetes, as well as the level of insulin produced by the pancreas. Next is the enzyme called lactic dehydrogenase. Now, that enzyme is found in cells in many of the body tissues, but in particular the heart, the liver, red blood cells, kidneys, skeletal muscle, brain, and lungs. So an elevation in lactic dehydrogenase is associated with a variety of disease states. Next is a lipid panel, and as you know, lipids are a group of fats and fat-like substances that are important constituents of the cells and also a source of energy. The lipid panel looks at total cholesterol, high-density lipoprotein, low-density lipoprotein, as well as triglycerides. Next is magnesium. Now, magnesium is involved in virtually every metabolic process occurring in the body. Magnesium is a component of the blood. It's needed for nerve transmission. It's used as an enzyme cofactor, and it's needed for protein synthesis. And it's important to remember that magnesium also helps regulate blood sugar levels or blood glucose levels and promotes normal blood pressure. Magnesium is also important for the production of glutathione, which, as I said earlier, is a powerful antioxidant. And magnesium also has a pivotal role in cellular and liver detoxification. And low levels of magnesium have been associated with neuromuscular disorders, hypertension, cardiac arrhythmias, insulin resistance, and disorders of bone metabolism. Next is the analyte uric acid, which is produced by the breakdown of the purines. Now, if too much uric acid is produced or enough is not removed, it can accumulate in the body and it can lead to a condition called gout. Now, excess uric acid can be deposited in the tissues, such as the kidneys, leading to kidney stones or kidney failure. Now, it's important to note that an increase in serum uric acid is a common finding in patients with hypertension, insulin resistance, obesity, and cardiovascular disease. The last core analyte or test is the urinalysis with microscopic examination. Now, many disorders can be detected in their early stages by identifying substances in the urine. The urinalysis is an important tool for assessing the chemical constituents in the urine and the relationship to various disease states such as urinary tract infection, diabetes, and kidney disease. Now it's on to the comprehensive bone health panel. So aside from the core analytes and tests that I just mentioned, the analytes on this slide and the next slide are included in the bone health panel. So let's review them. First is direct bilirubin. And as I said earlier, the comprehensive metabolic panel contains this analyte, which is total bilirubin. Now, bilirubin, as you probably know, is formed from the hemoglobin that is released from the breakdown of the RBCs, and an increase in total bilirubin typically means hepatobiliary dysfunction. Now, there are two main components of bilirubin, that's the direct bilirubin and indirect bilirubin. Now, an increase in direct bilirubin typically indicates gallstones, extrahepatic obstruction, or cholestasis. You can derive indirect bilirubin by subtracting the direct bilirubin value from the total bilirubin value. And an increase in indirect bilirubin is typically associated with anemias, especially hemolytic anemia, and a genetic disorder called Gilbert syndrome. Next is bone-specific alkaline phosphatase. measurement of skeletal or bone-specific alkaline phosphatase that is used to aid in the management of patients with Paget's disease as well as osteoporosis. Next is cortisol, and cortisol, as you know, is produced by the adrenal glands. And cortisol, in combination with DHEA, provides significant information about adrenal function as well as immune system function, since both systems are interconnected. And I want you to remember that cortisol, that's a hormone that plays a role in the metabolism of proteins, lipids, and carbohydrates. Cortisol affects blood glucose levels, it helps maintain blood pressure, and it also helps, as I said earlier, regulate the immune system. Now, in regard to bone health, elevated cortisol levels interfere with osteoblastic formation and dramatically decrease bone building, and that's going to result in a decrease in bone density. So it's important to take a look at this analyte. Next is high sensitivity C-reactive protein. Now, this is a protein that's made by the liver and is increased in the blood in association with inflammation somewhere in the body. Now, as it relates to bone health, fracture risk increases with increased CRP, so one should keep that in mind. Next is the hormone dihydroepiandrosterone, or DHEA. Now, in a nutshell, DHEA is a precursor to testosterone and estrogens. Therefore, the concentration of DHEA will affect the concentration of these and other hormones. DHEA is involved with development, growth, immune system response, and cardiovascular function. Now, as it relates to bone health, studies demonstrate a significant association between DHEA and increased bone mineral density, and that's likely due to DHEA's ability to increase osteoblastic activity. Next is the analyte called Deoxypyradinoline. Now, this analyte is used to assess bone resorption rates and the risk of developing metabolic bone diseases. Significantly high levels of this analyte are found in postmenopausal women due to estrogen deficiency and in patients with disease that have a high bone turnover rate. This analyte is a type 1 collagen that provides tensile strength to the collagen bone matrix, so it's important to know that. Next is F2 isoprostanes creatinine ratio. Now, the F2 isoprostane is produced in conditions that result in excess generation of free radicals, which are associated with oxidative stress, and oxidative stress can play a role in the breakdown of bone. Next is the analyte called intact N-terminal propeptide of type 1 procollagen. Now, this analyte is an indicator of type 1 collagen turnover and is useful in assessment of skeletal remodeling under normal and abnormal conditions. Next analyte is matrix metalloproteinase 9, which is a marker of inflammation, tissue remodeling, wound healing, and mobilization of tissue growth and mobilization of tissue-bound growth factors and cytokines. Next is osteocalcin, which is also known as bone GLA protein. Now, this is a major non-collagenous protein of the bone matrix, and it's synthesized by the osteoblasts. Now, after production, it is partially incorporated in the bone matrix and partially delivered to the circulatory system. An increased level in this analyte is found in bone diseases characterized by increased bone turnover. And such conditions include Paget's disease of the bone, cancer accompanied by bone metastasis, primary hyperparathyroidism, and renal osteodystrophy. Next is phosphorus, and as you probably know, phosphorus is a structural component of bone teeth and is essential for DNA, RNA, and ATP production, as well as the health of the cell membrane. And here's a great clinical pearl. When you look at your lab test, if you see that calcium and phosphorus are decreased and alkaline phosphatase is increased, that can be a sign of osteomalacia. Next is the serum protein electrophoresis test, and that is a principal test used for the detection of what's known as monoclonal gammopathies, which essentially means abnormal protein in the blood. Now, these abnormal proteins are usually found in association with hemetic neoplasms, especially multiple myeloma. Next is testosterone. Now, this test includes free, weekly bound, and the total amounts of testosterone. Now, the free and weekly bound testosterone is also referred to as the bioavailable testosterone, and that's going to reflect the individual's biologically active circulating testosterone. Now, elevated levels of free, weekly bound, and total testosterone are observed in female hirsutism, and on the opposite end of the spectrum, decreased levels has been associated with diminished libido as well as a loss of bone density. Next is the Thyroid Profile 2. Now, the analytes included in this profile include the free thyroxine index, T3 uptake, thyroid stimulating hormone, total T4, and total T3. Now, in regard to bone health, it's important to understand that thyroid hormones are essential for normal skeletal development and normal bone metabolism. The next analytes are vitamin D 25-hydroxy and 1,25-dihydroxyvitamin D. And as you know, vitamin D is important for calcium absorption, but it has also received widespread attention for its potential role in preventing cardiovascular disease and type 2 diabetes, as well as an immune system regulator. Now, the 1,25-dihydroxyvitamin D is a metabolically active form, and that's responsible for the action of vitamin D. And here's a great clinical pearl when you're looking at these two analytes. The serum 1,25-dihydroxyvitamin D is associated with higher bone turnover and poor bone health, despite being positively related to 25-hydroxyvitamin D. Essentially, a combination of a high 1,25-dihydroxyvitamin D and a low 25-hydroxyvitamin D is associated with the poorest bone health. So please keep that in mind. The final analyte is the Rbc Zinc. Now, zinc is crucial for proper thyroid hormone metabolism, and a zinc deficiency can result in a decrease in thyroid hormone level and a resting metabolic rate. Now, in regard to bone health, it's important to realize that zinc helps inhibit osteoclastic resorption or bone breakdown. So it's important to take a look at this analyte. Next, I want to talk about the prenatal and sexual health panels. Now, aside from these panels containing the core 1 analytes that I talked about, they also have what I call the core 2 analytes in common, which are listed on this slide. So let's review these core 2 analytes. So as you know, follicle-stimulating hormone and luteinizing hormone, they're produced by the pituitary gland, and they're useful in distinguishing primary gonadal failure from secondary gonadal failure. Now, in case you're not familiar, secondary gonadal failure means that there's a problem with the hypothalamus and/or pituitary. Now, the secretion of both LH and FSH are pulsatile in response to the normal intermittent release of what's known as gonadotropin-releasing hormone. Now, in females, both of these analytes vary over the course of the menstrual cycle, with peaks at the time of ovulation. These analytes are clinically useful in defining the menstrual cycle phases in infertility evaluation of women, as well as testicular dysfunction in men. Next is the herpes virus types 1 and type 2 specific antibodies. Now, this test is used to detect immunoglobulin G antibodies specific to herpes simplex virus types 1 and types 2. And the clinical usefulness of this test is essentially that it can confirm or rule out the possible infection of herpes simplex types 1 and type 2 virus in prenatal patients. Next is the HIV test. Now, this test uses what's known as 4th generation HIV screening and associated supplemental testing. Now, here's what you need to know about the 4th generation screening. Essentially, this test is used for the detection of acute infections that can provide an opportunity for early therapeutic intervention. Next is a thyroid profile with thyroid stimulating hormone, and this profile is going to include the free thyroxine index, T3 uptake, thyroid stimulating hormone, and total T4. What's important to know is that normal thyroid function is imperative for optimal health and fetal neurodevelopment. And since the occurrence of disorders of the thyroid gland are relatively common in women of childbearing age, it's important to take a look at this. Next is the treponema pallidum antibodies, which is a serological test for syphilis. And this particular test can be positive in all stages of syphilis. Next is the vitamin D 25-hydroxy, and vitamin D deficiency and insufficiency are common across the globe, and large epidemiological studies reveal a high prevalence of vitamin D deficiency in women, including prenatal and lactating mothers. So again, it's important to take a look at this. So here's the EDI Diagnostics complete prenatal panel. So let's review. The panel includes the analytes and tests I mentioned that are components of the Core 1 and Core 2 test, with additional analytes outlined on this slide and the next slide. So you get the Core 1 that I talked about and Core 2 on the previous slide with a host of additional analytes. So the first analyte is the ABO grouping and RH typing. Now, this test is used to determine ABO blood group and RH type, and grouping and typing of expected mothers and newborns may indicate potential for ABO hemolytic disease of the fetus/newborn, so you definitely want to take a look at this. Next is the antibody screen, is also known as the indirect Coombs test. Now, this test is used for the detection of atypical IgG antibodies prior to infusion, but also during pregnancy as well as other parts of the prenatal care. Now, the antibodies detected by the antibody screen will be subsequently identified, and a titer will be performed if the antibodies identified are considered to be clinically significant during pregnancy. What's important to know is that some antibodies can pass into the baby's bloodstream where they can do harm. So that's the benefit of this test. Next is indirect bilirubin, which I talked about before, but as it relates to pregnancy, disorders that cause elevated maternal bilirubin have been associated with increased risk for the fetus. Next is DHEA, which, as I said earlier, need to be aware that DHEA is a precursor to estrogen and testosterone, so therefore the concentration of DHEA will affect the concentration of these and other hormones. The next analyte is Rbc Folate. And as you most likely know, low serum folate during pregnancy has been associated with neural tube defects of the fetus, so it's important to take a look at this nutrient. Next is the hepatitis B surface antigen. Now, this assay is used in conjunction with other serological tests and clinical information to diagnose individuals with acute or chronic hepatitis B infection. Next is iodine. Now, this test is used for monitoring exposure to iodine, evaluate iodine deficiency disorders, and also excess iodine intake. Now, in regard to pregnancy, iodine deficiency has been associated with stillborn, abortion, congenital anomalies, and prenatal mortality. So once again, important to take a look at that. Next is methylmalonic acid. Now, this analyte is used to evaluate individuals with signs and symptoms associated with B12 deficiency, but it also can be used for a condition known as congenital methylmalonic acidemia. Now, in regard to prenatal care in pregnancy, what you need to know is that vitamin B12 is crucial for normal cell division and differentiation, and necessary for the development and myelination of the central nervous system. And poor vitamin B status in infancy is linked to poor growth and neurodevelopment. And I want you to remember that brain development starts from conception. The next analyte is the omega-3 and omega-6 fatty acids. Now, proper balance of these fatty acids is needed for proper inflammation and the proper anti-inflammatory response. It's also needed for the health of the cell membrane. Now, specific to pregnancy, although both DHEA and arachidonic acid appear to be essential to fetal central nervous system development, the relatively poor intake of EPA coupled with the high intake of linolenic acid, which produces arachidonic acid, may affect pregnancy outcome by altering the balance of the eicosanoids, which are hormone substances produced by the essential fatty acids. Bottom line here is that a high ratio of arachidonic acid to EPA may promote untoward effects such as preterm labor and preeclampsia. So it's important to take a look at the balance of the essential fatty acids. Now, here's a great clinical pearl in regard to the omega-3 and omega-6. Now, the time of the most rapid neural and retinal development occurs in the second half of the pregnancy, mainly during the third trimester. And on this basis, supplementation of the maternal diet later in pregnancy with omega-3 fatty acids, especially DHEA, is thought to be especially important. So you want to remember that. Next is phosphorus. And as I talked about earlier, phosphorus is an element that is essential for the components of bone, teeth, and is essential for RNA, DNA, and ATP production. The next analyte is progesterone. Now, this test is used to establish the presence of a functioning corpus luteum and luteal cell function. It's also used to assess placental function during pregnancy and is a part of the ovarian function test. So in short, the determination of progesterone is utilized in fertility diagnosis for the detection of ovulation and assessment of the luteal phase. The next analytes are prothrombin time and partial thromboplastin time. Now, the prothrombin time is used to evaluate the extrinsic coagulation system, and that's going to aid in the screening for congenital and acquired deficiencies of the clotting factors, particularly factors 1, 2, 5, 7, and 10. Now, the partial thromboplastin time is sensitive to deficiencies in the intrinsic coagulation pathway, and that's going to assess for factors 9, 11, and 8. Next is the analyte rubella antibody IgG. And as you know, the rubella virus is a cause for German measles, usually subclinical. However, when acquired in utero, the rubella virus can cause congenital rubella syndrome, and it can lead to fetal demise, malformation, deafness, and mental retardation. Next are the analytes free T4 and free T3. And as I mentioned earlier, This panel comes with the thyroid profile as well, but tacks on the active thyroid hormones, free T3 and free T4, because as I said earlier, it's important to assess thyroid function, thyroid metabolism prenatally. And here's a great clinical pearl. Now, thyroid disease is the second most common endocrine disorder affecting women of reproductive age. And when untreated during pregnancy, it's going to be associated with an increased risk of miscarriage, placental abortion, hypertensive disorders, and growth restriction. So you definitely want to take a look at the entire thyroid panel. And finally, Rbc Zinc. As I mentioned earlier, zinc is critical for proper thyroid function. Now, in regard to pregnancy, many women of childbearing age may have a mild to moderate zinc deficiency, and low zinc concentrations may be associated with preterm birth. Next is the comprehensive prenatal panel, and what that's going to include is the core analytes from core 1, the core 2 analytes, and all the analytes that I just mentioned in the complete prenatal panel, plus 4 additional analytes that you see on this slide. So here they are. The first one is known as 17-hydroxyprogesterone, which is a steroid hormone, and that's produced in the process of making cortisol. Now, this test is used to evaluate for what's known as congenital adrenal hyperplasia, which is an inherited condition. And the most common cause of congenital adrenal hyperplasia is a partial or complete lack of an enzyme known as 21-hydroxylase. That accounts for about 90% of cases. What's important here is that it is associated, or this condition is associated with infertility and spontaneous abortion. So you want to take a look at that. The next analyte is known as Anti-Cardiolipin Antibodies. Now, these antibodies are often present in individuals with a condition known as antiphospholipid antibody syndrome. That is an autoimmune disorder. Now, the signs and symptoms are going to vary, but many signs and symptoms are going to include blood clotting, miscarriage, rash, chronic headache, dementia, and seizure. So you want to see if these antibodies are present. Next is the analyte known as antiphosphatidylserine IgA, IgG, and IgM. Now, this analyte is used in the diagnosis of antiphospholipid syndrome that I just mentioned. And the final analyte in this panel is called lupus anticoagulant. Now, these anticoagulants are nonspecific antibodies that are associated with venous thrombosis, pulmonary embolism, arterial thrombosis, and recurrent fetal loss. Once again, you want to take a look at this as well. So now it's on to the comprehensive sexual health panel. So with this panel, you get the core 1 analytes, core 2 analytes, plus 4 additional analytes that you see on this slide. First is the diagnostic test assessing for chlamydia, Neisseria, and Trichomonas vaginalis by what's known as NAA. Now, the NAA stands for nucleic acid proliferation, essentially PCR testing, which is going to greatly improve the detection of the infection. Now, samples can be taken from the vaginal area, endocervical area, and the male urethra via a swab. Next is high sensitivity C-reactive protein. And as I said earlier, CRP is increased where there's inflammation somewhere in the body. Next is the hepatitis panel. And this panel includes a look for the hepatitis A antibody, hepatitis B core antibody, hepatitis B surface antigen, and hepatitis C antibody. And the final analyte on the comprehensive sexual health panel is testosterone, which is going to include the free, weekly bound, and total amounts, as I mentioned earlier. And that's going to take a look at the bioavailable or the active testosterone in the individual.
Thank you for that valuable insight, Dr. Sedano. We will now briefly review where to locate the ready-to-run Avexia Diagnostics panels. When you log into your Avexia account, you are automatically taken to the dashboard. From here, click on the Test Menu tab at the top of the page. You will then be directed to the Avexia Diagnostics test directory. Although you can enter Avexia into the keyword search box, you can simply click the quick link labeled Avexia Panels under the Featured Panels and Tests column on the right, which will bring you to the different categories of ready-to-run Avexia panels. At the top of each category page, this helpful resource provides a general, overall description of why the testing is important, followed by the list of available panels in the category. Scrolling further down the page is a comparison chart. Each panel from the category is listed at the top and can be clicked to be taken directly to a detailed information page specific to that panel. Moving from left to right, you will notice the panels become more comprehensive and encompass greater clinical insight. Test biomarkers are listed in the left-hand column, allowing you to see a breakdown of the analytes included in each panel. These are also clickable links that will take you to informational pages for each biomarker. These pages provide easy access to more specific details like the turnaround time, CPT codes, specimen type, stability, and an overview of the test. If applicable, individual analytes are also listed under the Components tab below the test name, and any particular instructions are listed under the Collection Details tab. Now let's briefly review how to order these panels. First, log into your Avexia account and click on the Avexia link option under the column labeled Quick Links on the left-hand side of the dashboard. Next, find your desired patient or create a new patient. Then, click the button labeled Add New Order to open the test menu and select the appropriate panel or test. Add it to the cart by simply clicking the plus sign on the left-hand side. Finally, preview and confirm your order once it has been added to your cart and complete the process by clicking the Place Order button. You can reach us during our extended business hours between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, by calling 888-852-2723, or contact us anytime via email at info@avexiadiagnostics.com. We are always happy to assist you with any needs or questions that you may have. Thank you again for joining us for this presentation. Until next time, from everyone at Avexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.